Hello, everyone. My name is Anthony, and I want to talk about my experience from rotator cuff repair, surgery, and bicep tendinosis. I'll start by saying I am not a physician. Uh, I am from Alabama, so pardon my southern twang and roll tide. The reason I'm making this video is the videos that I watched before surgery were really helpful, preparing me pre-op and post-op. So I just wanted to, give my experience from what I went through, what I've gone through so far. You know, how I got to the point of having to have rotator cuff surgery back in September 2018. I started having a pain in my left shoulder. I've had a problem in the past in my right shoulder. Had an actual impingement. Went through physical therapy. Kind of worked out fine. So it felt like the same pain, but this time physical therapy didn't help at all. After going through the process of physical therapy, and still having the pain, the doctor wanted to give me a cortisone shot, and I took it. It worked. It, it helped. It worked for about 2 months, and when it wore off, I'll say it wore off. The pain was even worse. The pain was worse, and I stopped all physical activities. I didn't do anything for a month. Push-ups, pull-ups, or whatever. So I figured rest is what I needed. So if I didn't have to use the arm to lift anything, I didn't. So after a month of inactivity, I tried to do a push-up. I couldn't get off of the ground. It was pretty painful. I went back to the doctor and told him the problem I was having, and they ordered the MRI. When the results came back from the MRI, he told me that my rotator cuff was 75% torn. 75%. Yeah. So it hurt. I could tell that it was really bad. So when he told me that it was 75% torn, it wasn't a surprise. After that, I knew that he told me that it wasn't going to get better on its own, and that I would, surgery was going to be the fix. The advice the doctor gave me, which I think was, some pretty good advice, knowing, how long the recovery was going to take. And he told me that, hey, look, you're going to be in a sling for 6 weeks. Recovery is 6 months to a year. If you want to take a vacation before the surgery, he suggested that, and that's what we did. So my family and I went on a vacation, and we went to Singapore. So if you've never been to Singapore, it's really nice. It's expensive, but it's nice. So we took the doctor's advice, went to Singapore, came back. It was a Saturday that we came back, and I had the surgery that following Monday. And I bring up the vacation because it took the anxiety away from the surgery or the days leading up to the surgery. I came back on a Saturday. I only had one day, Sunday, to be anxious about, the surgery, and then, Monday morning, I was at the doctor getting the repair done. So one of the concerns I had, and I brought up to the doctor pre-op, was about taking narcotics. I've never really taken narcotics. You hear all of the the bad things about narcotics, about people getting addicted to it. pills, when they're recovering from an injury. That was one of my concerns. I had a friend of mine shared an experience of his. He had back surgery, and he was taking, can't remember what it was. And after a while, he just kept taking them. And his wife asked him once, was his back hurting? And he kind of was like, why do you ask? And she was like, well, you just took a pill. And he unconsciously continued to take the medication, even though he wasn't feeling the pain. So, so that was a concern that I had about the narcotics. So my surgery took longer than most people. From the videos that I watched, the doctor told me that it was going to take 3 hours. But I initially went in there for rotator cuff repair. They said once they got into my arm, that sounds kind of weird, but once they got in, they would make the determination of whether to do bicep tendinosis. So as I said from the beginning of the video, I had the bicep tendinosis, and apparently that takes an hour because I was in there for 4 hours. I couldn't tell because I was asleep, but yeah, 4 hours. That was my experience. Was 4 hours. So the day of surgery, one of my experience with the nerve block was when they gave me the nerve block and they numb up your neck area before they block the nerves. And I never forget, I was laying there and the lady told me just look to the right while she was sticking me, and it was a monitor showing them blocking my nerves. So I'm actually watching them actually try and find the nerves to block my arm, which is kind of weird that like you got this needle in your neck and it tell you. She told me to watch the monitor, and I was doing exactly what I'm doing right now. I was kind of laughing at it. I was like, oh man, that looks pretty cool, but it didn't. I didn't feel it at all. I didn't feel them sticking me in my neck, and I didn't feel it once they blocked my nerve. So once that was done, it was time to give me the medication that knocked me out, and they cut me open. So there it was. The three medications I was prescribed were oxycodone, stool softener, and a nausea pill, nausea pills. The prescription for the oxycodone was to take 2 every 4 hours, and take the stool softener 1 every 6 hours. And I took them like clockwork. I had an alarm set every 4 hours. I took the oxycodone every 4 hours. For the first 4 days, every 4 hours, I took 2. On the 4th day, the doctor did call me, tell me that just to follow up after the surgery, and told me that he wanted me to get my arm out of the sling and start to do some controlled movements of my left arm, controlling the movements with my right arm, just to get the blood flowing and just to move it up and down. So what he said, what the doctor said, I did. Now on day 5, that medication, the narcotics, it started to have an effect on me. It made me feel like I had a sour stomach and heartburn all at the same time. So I stopped taking it as prescribed. I was taking probably 1 every 4 hours, and that lasted for about a half a day. And I was like, yeah, this pain is it's not going away. So I gave up on them altogether, and I just started taking Tylenol, and it's and that was fine. At that point, I didn't really need the narcotics. Some of the week 1, obviously week 1, I ain't gonna say it's the worst week, but it's the most difficult week. because you're not used to, you don't understand what is going to, cause pain to your prepared shoulder. I mean, it hurt to, uh, you know, obviously it hurt. It was difficult to sleep. I didn't, I didn't want to laugh. I could feel everything. Uh, I would go to sleep and you find yourself jumping in your sleep and you don't think about that stuff, normally, but a few times I would, just dozing off and I would jump and I would feel all of that in my shoulder. So, like I think you want to not move around as much as possible, but you don't want to just sit still. Um, you want to move around, get your blood flowing, and not just not just sit there and try and sleep your way through recovery. Uh, uh, Also, something that I was concerned about because I read about frozen shoulder. Obviously, frozen shoulder is, it takes a long period of time. It's not going to happen in 2 weeks or whatever. But once you got that in your mind, that that is something that can happen. You think that, if I don't get moving in, in a day, or if I take, a whole day and not get more arm out of the sling, my shoulder's going to be frozen. So, that's one thing that I had on my mind that, in the back of my mind, I knew it wouldn't happen, but in the front of my mind, I wanted to prevent. So, so I wanted to get my shoulder out of the sling as much as, I could without injuring myself. Sleep for me, I know a lot of people talked about sleeping in a recliner was the most comfortable, place to sleep or position to sleep in, but not for me. The first 2 weeks, the recliner was not comfortable at all. I was more comfortable sleeping. I had a sectional. Um, I would sleep on a sectional couch, and um, you know, I would lay in the L shape of the sectional with my right shoulder. That way, I could lean into it, and lay on the couch and kind of prop my left arm up on my side and kind of rest it there. I found that more comfortable the first few weeks than sleeping in a recliner. Um, but nothing's gonna be comfortable. I don't. You have to find your comfort zone, what works, and you know, just try and get as much sleep as possible, as often as you can, because first 2, 3 weeks is going to be rough. I don't know if I mentioned it before. I'm just over 5 weeks post-op and feel pretty good. Um, I went for my follow-up on week 2 to the surgeon. Week, exactly 2 weeks after they pulled my stitches out, looked at my scars, and they were just fine. Um, Sent me to the physical therapist, and he wanted to start physical therapy, you know, uh, like that day. And I'm thinking, man, week 2. Because in my mind, I'm watching the videos and I'm thinking about what other people's experiences were. Some people didn't start physical therapy, until the 6 week mark. Some people didn't start until, till later on. So I'm thinking the same thing for me, that, okay, I'm not going to start physical therapy for 3 weeks. So it kind of shocked me that he wanted me to start physical therapy right away. So I told him, okay, I'll start at week 3. So I started physical therapy at 3 weeks, doing some control movements, abduction exercises, using the pulley, and he had me use a cane to, do some stretches, which, you know, like I say, they hurt pretty good. He also massaged my arm. The first appointment, a physical therapy appointment, to break up the scar tissue. And let me tell you something. That hurt. It hurts. I can't imagine. And this was at week 3. I can't imagine going 6 weeks and having that scar tissue broken up because it was painful. I'm glad it was at 6 weeks because if it was at, I mean, it was at 3 weeks because if it was at 6 weeks, I would have probably been in there crying. Man, it hurt bad. So the first time was worse than the second. My second appointment, he massaged out again. It was a little bit, it was a lot less scar tissue than the initial appointment. He massaged it again, and I was just praying, man. When I go back in there, hopefully on the third appointment he doesn't massage my arm again, because it was pretty painful, but it wasn't something that was that I couldn't tolerate. Uh, uh, Also, what I did was I started to mimic the exercises from physical therapy while I was at home. So the days that I didn't go to see the physical therapist, I did the same exercises at home. Um, because I mean, to tell you the truth, I think two times a 2 times a week is not enough. Now, I didn't do anything more than they was having me do at physical therapy um, because I didn't want to overdo it. I didn't want to do anything that I wasn't instructed on how to do, and I didn't want. The second and third week, started to do so to check my range of motion, and he he could tell that I was doing the exercises at home, you know, as required because you want to recover as fast as possible, but I don't think you can. It's not going to expedite the process, but it makes it a lot easier if you're proactive in your exercises. So, the stress ball, I squeeze the stress ball as much as possible, um, which he also recommended that just constantly using that stress ball. Also, he recommended that that I massage, keep massaging my arm. Um, yeah, I'm gonna do whatever you say because if he had to massage my arm like he did when he broke up that scar tissue, man, I can't tolerate that. I can't tolerate that anymore. Um, and something else I wanted to add was I did get took the recommendation from some of the videos from some of the people that I watched their videos about the ice machine. I got the I want to say it exactly right. I think wrote it down. Polar Polar Product Active Ice Therapy System. Um, Man, I'm addicted to that thing. I use it. I use it at least twice a day. Um, Took the recommendation of some of the folks on the videos using frozen water bottles instead of ice. Keeps the water cold longer. And I also got the one with the digital timer. It allows me to turn it on and off. It allows me to run it for 30 minutes, 60 minutes, 90 minutes, 120 minutes at a time. At first, I was running it for, uh, 60, 90 minutes, man, because it helped. Um, it helped, especially when I stopped taking the narcotics. Um, it helped take a lot of the pain away. So that was a great suggestion from the rotator cuff community, and I probably use that thing for the rest of my life. You can also use it on if you have other injuries, which I don't plan on getting any other injuries, but you can change the attachments for if you need it for your if you have for your knees and elbows and different things like that. One thing I will suggest is to consider the size of the uh, the shoulder. I don't know if you call it a shoulder pad or whatnot. I mean, I'm not the, I'm not the biggest guy in the world, but I'm not that small. Even though it may look so, I'm not that small. Mine is the large, but it is kind of big. So for the guys, I think you'd be fine with a medium size. That way, it'll fit. It'll lay on your shoulder. You have pretty good coverage, and it'll work. It'll work just fine. So take that into consideration if you plan on buying one of the polar ice therapy machines. I love it. So it's just my this just my experience from rotator cuff repair. Hopefully, I can ditch this sling pretty soon. Not being able to drive for 6 weeks is yeah, it sucks pretty bad. Um, so hopefully my experience will be somewhat of a help to somebody that's having a therapy in the future, or not therapy, uh, uh, rotator cuff repair in the future. I went to therapy this morning too. Yeah, it was pretty rough. But you know, somebody that's having rotator cuff repair in the future, hopefully I can help them. So thanks for watching.